I mean, the first thing I'd have to say, when we started working in this area in Saskatoon, the type of data that we were starting to generate was shocking. The degree of health inequalities for different subpopulations. And we recognized right away that it would be irresponsible to just publish that data without doing some preparatory work. And that was both preparation with those that were affected, so a nothing about us without us approach, and working with the communities that were affected, both geographically and subpopulations, different cultures, different socioeconomic groups, et cetera, to say, here's what we found. How does this make you feel? What is this? What do you think is behind this? What's driving it? So that before we even came with any kinds of solutions, it would be informed by those that are experiencing the need, first of all. And then secondly, with those who would likely be charged with responding to those needs. So leaders from intersectoral groups and government agencies and NGOs to say, this is the kind of data we're finding. What do you think is behind it? So that would be the first lesson, is just involvement of those that are impacted to help find those solutions, drawing, yes, on literature and what's been proven to work elsewhere, and then collaborate intersectorally to see if we can jointly announce some first steps of actions to take. I think another lesson is just recognizing that it's huge. When you want to embark on something like this, you have to take a step back and say, am I in this for the long haul? This isn't something that we can do like many programs where it's a short-term investment. You're saying this is part of our core programs and services and something that the community and other groups can count on us being in for the long haul, because it's going to take time and persistence. And then in doing so, say, what is our role in that? It's not, like many things in public health, it's not our sole responsibility to get involved, but we're a crucial partner. So looking at the coalition of groups that you bring to the table, what is public health's strength or unique contributions we can bring? That convener role and collaborator role, if you have those established relationships already, can go a long way. But this may be different in different local areas across the country, depending on the extent you've done that in the past. So finding out who is talking about these issues and then joining the conversation if you're not already there, and then seeing what you can bring to the table is important. I think the other thing we learned is doing a bit of an assessment of what is the level of both political will and public support in your local jurisdiction. And if either one or both are lacking, what can you do to ready the ground, if you will, for a later harvest? So creating public awareness about the needs, and that in fact there are evidence-based policy options that you can put on the table, and trying to build public support for those. I think the other was just the power of coalitions, that often, depending on the election cycle or the issue that's being talked about, some people are more able to speak at a certain time or be more vocal, and others are not. But that changes with time and who it is you're speaking to and about what topic. So if you have a coalition and you're all providing the same information and sharing that resource, different members of that coalition can take different roles at different times and keep the agenda going. And finding that language that resonates with the decision maker, that how can you help meet their needs with a health and all policies approach. I would say one other lesson we learned was about language being spoken, and sometimes even just the term health and all policies or health equity sounds like health imperialism. Like, we're from health, we're already getting the lion's share of government's budget, and now we're telling you how to do your work too. And that's not what it's about. It's about a joined up response to creating a healthy environment and living conditions to have a well-being in society or for the citizenry, which is really what all government is about. And reframing it in that way sometimes means taking the health language out of it and just recognizing that what we're trying to do is optimize how all of these joined services work together to create more well-being for citizens or for a community.